All right, KNES 415 Biomechanics. I'm going to give you a second to pause this video and open your support materials, and so that way we can kind of follow along. I have my desktop here. That's why I'm going to glance over to make sure I'm with you guys, synced up with the pages and the page numbers. So the first test is going to be on content, muscles of the cervical spine, muscles of the trunk, and then the first parts of your support materials, which is origins of biomechanics, areas of research, basically like an introduction to biomechanics. Um, I wanted to get the concepts of the cross-sectional anatomy to you so that you could study it and learn it. And I'm going to put the introductory into biomechanics, movement strategies, and the introductory stuff with it, because there's not a ton of muscles. So it's the first kind of time you get this information that can make it a little tricky. I don't want to go into cervical trunk and then go into appendages because there are some different rules with appendages. So I'm going to stop there in terms of muscle function information and supplement more info with kind of some of the more traditional biomechanical terms and things. And so that'll be your first test. And then your second test will be on one of the extremities, and then your third test will be on the other extremity, and your fourth test will be on more traditional biomechanical terms, equations, and trigonometry, and that kind of stuff. Okay. So page number 1, biomechanics. Um, the definition of biomechanics: the application of mechanical principles to biological systems. So playing fast and loose with the words in between is not important. What's important is biological systems. It's instinctual to say, well, biomechanics is the application of mechanics, physics, to humans, and that's not false. But we are a biological system, and mechanics or physics can be applied to any living organism. So think about what makes biology biology. It's living chemistry. And so what makes biomechanics is taking physics, and instead of applying it to buildings and bridges and automobiles, we apply it to biological systems. Humans being one of those biological systems. But there are people that look at the biomechanics of how horses gallop, how dogs wag their tails, how dolphins move, how butterflies fly, so you can apply these things to anything. In fact, some of my friends, uh, uh, they study chiropractic, and they apply their chiropractic biomechanical knowledge to dogs and pets, horses. So there's different biomechanical structures and different places where the musculature is. And so applying biomechanics, applying the principles of mechanics can be to any biological system. Okay, so a good test question would be: biomechanics is the application of mechanical principles to humans. And I might say which of the following is most true. And although we can do to humans, if you see another answer that says biological systems, that is also humans, but it also includes any other living organism that you're applying your mechanics to. Okay. Occupational biomechanics. The reason this is here is because it brings up a conversation to basically occupational biomechanics is ergonomics. So occupational biomechanics is typically at a conflict of interest with strength and conditioning coaching. I'll explain why. But a lot of times in kinesiology, when you're studying at the university, we tend to put a lot of our analogies with sport, exercise, fitness. In other words, things that you don't typically you do as a hobby or activity or fun. Can you play sports for a living? Yeah, but that's not the norm. Those are the exceptions, and I'll get to why even that has a conflict of interest with occupational biomechanics. So occupational biomechanics in a nutshell is to try to fit a work environment around a person and not just put a person into a random work environment. In other words, to try to efficiently and effectively create a safe working environment that's going to stress the human body. And when I say stress, not only like macro stress, like having to lift heavy things. You could get a hernia, you could have a stroke, you could pull a muscle, you could hurt your back. But micro things like repetitive lifting, repetitive bending. Imagine like an administrative assistant holding a phone to their ear for hours. That's micro trauma, and that's not good too. So basically, occupational biomechanics is trying to minimize risk of injury, whether that's acute injury or chronic injury, because when someone at work gets hurt, you have to not only pay them, you got to typically pay their therapy, their rehab, and then you got to hire someone to do their job. And so that's the first hint at the difference between traditional sports and occupation. In traditional sports, you have backups. You have a backup left tackle. You have a backup quarterback. You have a backup point guard. You have backups where if someone gets hurt, the game can still be played. And so because you have backups, and a lot of times because performance matters, you tend to stress the human body more to its limits because you need to adapt, you need to build muscle, and you need to develop these reflexes, and it's acceptable to risk injury more in those types of things. Legally, it's not very bright to risk injury in a work setting. You think about offshore work, that's some dangerous work. So because it's legally, intrinsically dangerous, you have to have a lot of safety precautions. People have the right to work in a safe environment. And that's where occupational biomechanist or ergonomist, and you think about anything in your kitchen that's ergonomically designed, it's biomechanically designed to make it less stressful to use or more efficiently to use. So ergonomists or occupational biomechanists save companies money by going to a work setting. Let's say a occupational biomechanist goes to the tire factory, and they do work evaluations on every job out there, from the administrative assistants to the people slinging tires in the back. And they make note of how many times does the administrative assistant twist their trunk to get a folder. And let's say the folders are on the bottom right. And over the course of an hour, they have to slouch down, twist, bend, grab. And so, hey, let's move the folders. We're gonna move the folders to where you don't have to flex and twist. It'll be more here. We're gonna create a movable standing desk. The new desks that they have, right? So that way you're not seated for hours and hours. And it doesn't even have to be like design. It could be suggestions like we're going to set a timer, and every 30 minutes you are to get up and walk around the facility just to stir up blood flow, so we minimize clots and take some stress off of your back. And some examples of some of the biomechanical things like safety-wise, you're not supposed to lift more than 51 pounds under optimal conditions. Now, again, you're like 51 pounds, big deal. But if you lift that 51 pounds 100 times an hour for 8 hours a day, it adds up. If I tap myself on the shoulder, that doesn't hurt. But if I tap myself for 8 hours, I'm going to have a bruise. It's going to hurt. So remember, some of these guidelines may seem extreme, but unlike sports, some of these occupations who are doing some serious stress to their bodies. I mean, if you think about it, they're athletes. They're in hot working environments sometimes, but there's no off season. You know, in sport, you have an off season where any injuries you can recover and rehab. That's another reason why in sport we tend to stress more, because we know we can kind of pay it back during the off season. But the gentleman slinging tires at the Uniroyal factory, there's no off season, and he's got to sling those tires to put food on the table. So your practices in college and high school, you know, maybe a couple hours, and I know there's strength and conditioning work and other things, but you practice for a couple hours. These cats are working all day. So again, it's not the same. It's not the same game. Stressing the body for optimal performance, creating a safe work environment to minimize workman's comp, legal liabilities, you know, getting sued for unsafe work practices. It's not good. And so where there's money in it for people to do this for a living is you're saving that business money. Think of it like this. For every dollar they invest in your expertise, you're saving them $4. 10 years ago, that was the number. It probably changed by now. But you're saving them money because by redesigning a safe work environment, you're going to have less people miss work because of injury. You're going to have less people sue. Having less in injury claims and stuff is probably going to decrease your insurance. So there's money in creating safe work environments, and it's also the right thing to do. You want people to work where it's safe. Okay. So that is occupational biomechanics. Another term for it is ergonomics. Okay. Specific areas of study within biomechanics on that same page. You can improve sport technique with biomechanics, and it's a relative continuum. I'm going to use the word continuum a lot, but let me explain what a continuum is. Imagine every person that's ever lived on planet Earth was slotted, the shortest person that's ever lived and the tallest person that's ever lived. And every person that's ever lived on this earth is slotted somewhere in there, and no two people are ever the same. How do I know that? Well, if you have two people that you think are the same height, then you can zoom in and zoom in and zoom in and zoom in to the fraction of a 0.0000000 decimeter. And there's going to be a little difference. And if there's no difference there, then you just keep adding O's. 0.000000001 micrometer. Eventually, you're going to run out of O's, and there's going to be a number there, and that's the difference. It's all theoretical, but you understand what I'm saying. It's theoretically true. Every person that's ever lived is not the same height, because we could keep zeroing in to differentiate it. So that's a continuum. And continuums get tricky because let's say we wanted to categorize people into two main categories, tall and short. Well, where do you draw the line? Oh, well, let's split it. Half of the people are going to be tall and half of the people are going to be short. And when you split it down the line, you just basically split two people that are statistically the same height. And because of 0.000000001 micrometers, this person is considered tall, and because of 0.00000 micrometers, this guy's short. It's an extreme concept of a continuum. Okay, so a lot of these are continuums. Improvement of sport technique. Good Lord, you can improve a child's technique. You can improve an advanced person's technique. You know, there's pros who hire coaches to help their technique. Because, you know, just like when you hear yourself talk, you sound different. When you are analyzing your own motion or technique, you may not see things that other outside people can see. So improving sport technique is very relative, but there are people who get paid money to work with athletes to improve their technique. In addition, biomechanics has improved technique in general. What I mean by that is in the high jump, for instance, they used to high jump, you know, you just hurdle over it or they do like this little leap thing where they go over it first. And then Dick Fosbury in the 70s did what they call a Fosbury flop, where he arched his back over the bar. And basically what that meant is his center of mass was able to get closer to the bar. Let me give you an example. If this is the bar and I hurdled over it, like I jumped over it like a hurdle, well, my center of mass is going to be way up over the bar because I have a lot of stuff I'm getting over the bar if I'm upright. But if I arc my back and go over it flat, well, then the distribution of my stuff can barely pass over the bar. So that's less linear work that I have to do. It's more efficient work, not less work, but more efficient work. Okay. That was a biomechanical technique. We didn't evolve into a new species. It was just the technique of a task of how high can you get over a bar. And now everybody jumps that way. Flip turns in swimming is another example, where in the past they used to get to the end, stop, turn around and push off. And then someone said, wow, what if I just did a somersault and then pushed off? It was just a technique, a biomechanical technique that was very efficient. Kicking a football is another example, but not for distance or velocity, but for accuracy. You know, if you asked any pro coach, would you rather someone who can every once in a blue moon hit a 75-yarder, but they're not very accurate, or someone who can hit 50-yarders consistently every day on holidays and weekends? They're going to want the person who's consistent. Accuracy gets you points. And so the evolution of soccer-style kicking, where you're getting more surface area on the ball to help with the accuracy. You know, they still have a lot of high school kids. You know, well, soccer's not around every place, but kids that'll kick with the point of their toe. They'll toe the ball because and you can hit it pretty far, but you better be accurate, because if this is the ball and this is the toe, if you're just a little bit high, that ball's going to hit the center in the butt. If you're a little bit low, the ball's going to plop up in the air. If you're a little bit to the right, it's going to shank that way. If you're a little bit to the left, it's going to shank that way. When you put all of your force into a very small surface area, the accuracy has to be on point. So by kicking soccer style, by increasing the surface area, you take away from the impulse, you take away from the force per surface area at the trade-off of accuracy, because having more surface area is going to make it be more accurate. Okay? So with biomechanics, you can improve technique. All my physical educators, man, that's important, right? To improve technique by understanding biomechanics, okay? And that's across the board. That's across the board. Now, what we do have to remember is that improving sport technique, again, is a continuum. You cannot take someone who is, well, I'm going to get to this in the next segment, but I'm going to hint on it. You can't take someone who has the genetic potential to throw 80 miles an hour tops and teach them the mechanics to throw 100 miles an hour. In other words, there is some genetic potential involved. I can't improve my technique to run a 10 flat 100 meters. Okay, I can improve my technique to run faster, but I can't cut in front of the line by improving my technique to make me the fastest person in the world. There still has to be some genetic lottery involved. Okay, so improve sport technique. Biomechanics and biomechanists design sport equipment. All the machines in the weight room, that's all biomechanically designed and ergonomically designed too. What I mean by the ergonomically, this is where I love this topic, because it brings home all the different areas. Because, you know, the exercise science part, you want your exercise machines to strengthen you, and specific adaptations to impose demands, and Wolff's Law and all that fancy stuff. But ergonomically, you want each piece of equipment, and I'm not talking about dumbbells, equipment, things you sit in and you adjust, right? You could adjust the seat, you could adjust the hands, you could adjust the... Ergonomically, you would love for 95% of the population to be able to use that machine by all the adjustments. Whether you're tall, whether you're short, whether you're bigger, whether you're slimmer, you would love to be able to accommodate as many people within a continuum of sizes that you can for that machine. Okay? That takes someone who has background in mechanics to be able to design that equipment, the adjustments and the seating adjustments and all that stuff to be able to accommodate as many people as possible. That's occupational biomechanics. Okay. So design a sport equipment, not just with that kind of stuff. Think of the evolution of equipment. Bicycles, I mean, they used to be heavy. Now they're light. Makes sense why. Golf clubs used to be like bamboo, and now they're, unbelievably flexible. You get stored elastic potential energy with the graphite stuff. And tennis rackets used to be made of wood. Just tennis shoes, just the evolution of tennis shoes, the evolution of swimsuits and like to reduce drag in the water. Fascinating, really, really fascinating. I'm going to link a TED Talk that goes into biomechanics and different areas of biomechanics, and one of them is the equipment, how changes in equipment really significantly went to improvement. Okay, so design of equipment is biomechanically based because you have to understand the physics and you have to understand who's using the stuff, the biological system. That's us. Okay. Oh, I kind of leaned in. Seeing if you're paying attention. He's coming out at me like the Ring. Prevention of injury. Ooh, from athletic training majors, and not just them, but any of you that are going to be going into allied health. There is usually a conflict of interest, inverse proportionality to improve performance through sport equipment and prevention of injuries. So let me give you a couple examples. When I was in school, college, I started college in '95, back in my day, and not field turf, but turf, artificial turf was just being invented. And turf was incredible for performance because the return on the energy was incredible, and you can run as fast as a deer, or at least you felt relatively fast on it because you were faster on the turf. If you're running on grass, the grass gives. Think about it like this. If you're trying to run in mud, you don't run very fast. Why? Because the mud gives. You sling in mud to the back. Grass, you sling in chunks of grass. The energy that you're giving the ground moves the ground sometimes. The energy that you're giving the turf, that turf ain't going anywhere. So you get back all of that energy. Ground reaction force, we call it. So that's great for running fast, man. Those guys are running fast. Kids is blowing out their knees because with tremendous force, reabsorption coming back at you, that force got to go somewhere. Be careful what you ask for, you just might get it. In addition to joints, concussions, landing on a surface that doesn't give is not good for the egg that's in your eggshell. And so what they found is that although this was great for performance, it wasn't so great for injuries in terms of increase of injuries. So then they started having to modify it. They had to let the ground give a little bit, and that's where the evolution of field turf came, where there's little bits of rubber and little pieces so that when you push on the ground, some of that ground gives so that you don't get back all of that energy. Okay. You think about NASCAR. I'm just trying to give examples that are very practical, that are easy to understand. If they wanted to, they could make those cars go 300 miles an hour, but they don't because that wouldn't be safe. So they tap off at some of the super speedways, 200 miles an hour max, but that's still crazy fast. So again, it's kind of, could we make the cars better for performance, faster? Yes. Is it safer to do so? So it's again example of where biomechanics for performance may be at a conflict of interest for biomechanics of safety and injury prevention. Okay. A lot of different examples. Helmet design has gotten a lot more involved into safety over performance. That's a fun conversation. Okay. Clinical analysis of movement pathologies. That's a fancy way of saying that in biomechanics, we can look at people who have problems with how they walk, how they work, how they do activities of daily living. And it doesn't just have to be about performance, is what I'm trying to get to. You therapists, a lot of therapists, their motivation to getting into therapy is because of some sport-related injury. Typically, I'm not saying that's everybody, but typically that's what I hear a lot of. We're in kinesiology. A lot of this stuff is sport-related. But the point is that movement pathologies can be just activities of daily living, like working with granny and mama and papa to work with their movement pathologies where their hip drops when they walk, or they're swinging their leg across, or they have drop foot, or they're having problems getting their arm up to get the dishes off. And just there's all kinds of different movement pathologies that are just involved in being alive. Doesn't have to be sport and exercise related. And you can work with them in your therapy in working with their movement pathologies. And it doesn't have to be old people. It could be young people. It could be people recovering from a stroke. It could be people recovering from a palsy. It could be a lot of different things, but having an understanding of how mechanical principles apply to biological systems will allow you to be a better clinician when working with people with different movement pathologies. Okay. In other words, they don't move the way they should, and you need to help them so that they can be more efficient in their movements. Okay. A good example of this is one therapist. I won't say his name in the lecture, but a real good guy, real good therapist, old friend of mine. And he brings up that if a patient comes into his clinic because of a knee, but I notice they have pathologies other places, I'm going to work with them on correcting those pathologies, because it's only a matter of time. If you have bad posture, or you're having problems moving, if you have decreased function, it's only a matter of time before that limited function is going to manifest into problems down the road. So he looks at every person that comes into the clinic as, I'm working on the person. Yeah, they may be here because of a knee, but I'm looking at trying to improve overall movement for that person so that they can have better movement strategies in their activities of daily living. Okay. Guys, design of prosthetics. It's the next bullet point. Okay. I am on page 2. Pause it if you got to find page 2. Design of prosthetics. This is big. This is growing. I could at least name 3 students that are currently in a graduate school for prosthetics and orthotics design. It's a growing field, y'all. No longer do people that have lost a leg or an arm in an accident, a work accident, a home accident, serving our country accident or attack, no longer are, remember from Forrest Gump, Lieutenant Dan, you got new legs. Yeah, we can give everybody new legs now with our technology, but every leg design can't be the same because we are all different. We have different levers, we have different bone densities, so you can't just mass produce limbs and treat them like Legos. Every prosthetic, whether it's an arm, whether it's a leg, whether it's a scapula. I've seen scapula and shoulder prosthetics, incredible. Every one of them has to be a custom job. It has to be made to fit the person. So that's kind of a occupational biomechanical / biomechanical concept. It's cool. It has to be made to fit the person because it's going to be used by the person in sync with all their other levers. Okay. It's a great field. There's nothing like watching videos of little children getting their prosthetic and being able to look at this hand, that's the prosthetic hand, almost look exactly like the other hand. And the way they design them is, some of them, I'm just giving an example, but let's say a prosthetic arm they can control the muscle contraction inside their sensors. And so let's say if they contract their flexor group muscles, it'll make the hand do something. And if they contract their extensors, and if they co-contract, it may like pronate them. And if they co-contract with a flexion, it may supinate them. Like I'm giving examples. But y'all, unbelievably powerful to see a child who didn't have a limb and then all of a sudden they have a limb. They feel normal. And psychologically, you know, from not getting teased or not getting looked at, just especially for those kids, man, it's incredible. Powerfully impactful career. So, but that's biomechanics. You have to understand, you have to have an above average understanding of the human side, and you have to have some understanding of the mechanical side. You have to be a human engineer, biological system engineer. Okay. So when I took classes with the engineers at Auburn, that's where I did my doctorate, and I had a lot of classes with industrial and systems engineers. Man, those guys really understood the math, the mechanics. They were jealous of me because I really understood the human body. I came from an athletic training background in my undergrad and exercise phys background in my master's. But I looked at them as, man, you guys understand the mechanics. But I would rather understand the human body is more complex. When you think of the anatomy and the physiology, it's a lot more complex than understanding a few math principles. Okay. Nothing against mechanics and the math part, but my point is that you guys already have a head start. You got the human body side as your expertise. And then in grad school, you could just learn the better develop and master the mechanics, already having the biology part. Okay. So prosthetics, man, prosthetics design, what a great field. Design of rehab devices. I actually touched upon this with sport equipment. So sport equipment, of course, again, could be literally the football, the tennis racket, whatever. And then the rehab devices, man, that's your isokinetic machines, your biodexes, your therapy machines, your TheraBands, your treadmills, like. So rehab devices could be strength and conditioning devices because we use them as rehab, or they could be specialty things. So I remember 10 years ago now, you know, they're out there a lot, but I remember seeing the underwater treadmills for the first time. So the concept is that if you're in water, the water can help create buoyancy and lessen your weight, right? So that way you can have what if pain is your limiting factor? If you have a lower extremity injury and pain is your limiting factor, you're gonna not walk normal. And in therapy and rehab, we don't want people to create bad walking habits. That's why we don't say when you walk with a crutch, flex a leg and hobble on. We say no. Take the weight off, but still try your best when you can to have a normal walking gait. You're just not loading with all your weight. But we want you to go slow and controlled with your crutches and try to walk normal. And so when I saw this underwater treadmill, I was fascinated because again, the water buoyancy, and you can obviously change the level of the water so that way you can buoyant more, you can buoyant less. But by taking some weight off, it allows them to have a normal walking cycle with less force and less pain. And they had some that worked with vacuum. They would put them in a vacuum, and then the air pressure would kind of lift them up to take pressure off of the feet. Some fascinating, cool stuff. Rehab devices that simulate games, you know, with a lot of kids now being gamers, where you're doing rehab with imagine like the Wii, you know, where you're doing tasks digitally and you're trying to score max points, but it's a rehab. It's a rehab game. and you're getting competitive and you want to increase your score from yesterday, and they can increase the difficulty, you know, as you progress your rehab. And so many cool things. So what I want you to think about isn't the the advancements itself, but the people that had to develop the advancements, needing the biomechanical background to do so. Okay. All right. We got all of our 310 review for motion. All right. Okay. A couple more things I want to talk about. This is going to be the last part of this lecture, and it goes back to the biomechanical definition of biomechanics. We are bound by the laws of physics. What I mean by that is Michael Jordan did not defy gravity. Michael Jordan is bound by gravity. It looks like he defied gravity because no one saw someone jump that high before, and it looks different. When someone does something that's not what we expect, then it looks like it doesn't follow the same rules. Does that make sense? In other words, 99.99999% of people that you've ever seen jumped don't jump like Michael Jordan. So when a Michael Jordan comes along and every person you see jump follows this parabola, and then you get a Michael Jordan parabola, you're like, whoa, that defies physics. But really what we're saying is it defies what we expected to see. And a lot of times we replace our ignorance with these kind of catch-all terms like defied physics. But we don't. We all are bound by physics. So we're all bound by the same rules. And the illusion here is that the secondary absolute is we are bound by our morphology. We're bound by our genetic limitations. That goes back to the continuum, where when I have my genetics gifted to me, you know, think about a trillion-sided dice, and you roll these dice, and all right, you could get your mom's this, or you could get your dad's this, but there's a 25% chance you could get your grandpa's this, and you're playing all these games with your levers and your eye color and your telomeres, and you are bound by what your genetic potential is. So where that gets confusing is, I'm not saying that you can't improve on anything. You can. But what I'm saying is that improvement is limited within your window of genetic limitation. I can improve my speed, yes. But I can't work hard enough where I become the fastest man in the world, because I wasn't born with the genetic potential to be the fastest man in the world. Okay? And you get some really cool overlap. Again, let's think of a potential for speed. You got the slowest person that's ever been lived. You got the fastest person that's ever been lived. Any two people on that continuum, you could have one person who was born with the potential to be faster than another person. But this person trains and learns efficient running techniques and does everything they can to increase their speed, and then they pass up the person who was born with more potential, but they just didn't train. So you can pass up people who are in your functional window. But what I'm trying to get to is that you can't be born on this end of the continuum and pass up everybody to get up here, okay? True greatness, the Michael Jordans, the Muhammad Alis, you know, who's the guy, Michael Phelps. This will be in the video that I post as a supplement to this lecture. Michael Phelps was literally born a human dolphin. He's got a long trunk, like an abnormally long trunk. Michael Phelps is 6'4". and he has the same pant size as someone who's like 5'7". He just got this really long trunk, which it ends up, and if you don't know, Michael Phelps is one of the greatest swimmers ever. His long trunk serves like the hull of a canoe. And he's got these big long arms that serve like rowers in the water. He is biomechanically designed to be a human dolphin. So he was born on this end of the swimming continuum. But then on top of that, that dude works his butt off. So he is going to be the most efficient dolphin that he could possibly be. So the true greats of any field are not only born with genetic potential, born with upper level morphology, but then they improve that morphology to the absolute max. Okay. So I hope that clarifies this lecture. It's all about slide 1. I'm going to get into human movement strategies for strength, speed, power. Then I'm going to get into some movement patterns for chains, closed, open, that kind of stuff. And then we're going to have our first test. So we're probably looking at mid-September. So your first test is going to be cross-sectional anatomy for cervical and trunk muscles, the stuff you have one of, and the introductory stuff for biomechanics, movement strategies for performance, and movement strategies for exercise. All right. In addition, I'm going to have some questions from the TED Talk video that I'm going to post as a supplemental video, and I'll review the kind of questions I'll ask about, so don't stress out, okay? I'm going to clarify. I hope everybody's doing well. Stay safe. Again, 24/7 office hours. Just text me and let's find a time to talk. We'll hit you up for the next lecture.